like, is my dog like too old to have a dental? And that's a really hard question to answer, just like, broad spectrum, like across the board. It really depends on the dog. It depends on lots of factors. Are there any other like underlying diseases? How severe is the dental disease? Is there anything that would make the risk not worth the benefit for them? And so it really winds up being like an individual per patient kind of basis. Is like, does this dog have other underlying problems that would preclude them from undergoing anesthesia? What and that is just I guess a discussion. I feel like sometimes it may be a 90-second discussion, or like it could be a 90-minute discussion with the owner, but trying to to educate them on what the pet's needs are, and also kind of going through the steps and processes that we do to select the best candidates for anesthesia, because that is the biggest kind of underlying factor. Is like, is there anything for the pet that would say like, we do not want to put this pet under anesthesia? But often sometimes we run into like urgent or emergent situations to where the pet does have like acute severe dental problem that finally kind of rears its head, even though they've had like kind of moderate to severe chronic disease. So occasionally we will have the pet that comes in that that has like a dental abscess, and they're the abscess is happening behind their eye, and you need to take the teeth out, or the tooth that's affecting them, or it's ruptured under their face, or either sometimes they'll have like a draining tract, if you could see my jaw. But sometimes they may have a draining tract coming from their jaw. But there are situations that I've done this before, and I've counseled people on saying like, if they're concerned about it, I don't ever want to like negate an owner's concerns about anesthesia, because there's, as I guess in vet school, it's like there's no safe anesthesia, just safe anesthetists. So trying to pick and choose what patients and identify any problems, but oftentimes we're faced with an emergent or urgent situation, and we've put off a dental because of the pet's health, but now the pet's health is directly affected by the severe dental disease or this urgent or emergent problem. So occasionally you'll have those to where it's like you've not done a dental, and then all of a sudden you're faced with having to do a dental, and those are tough. But I think that being in those situations kind of affects or the way that I may address the person that could be reluctant. But again, I do not ever want to completely negate someone's concerns, because I'll always tell people if anything bad happens to their pet, it doesn't matter what the statistics are. It 100% happened to them, but anesthetic risk tends to be low, but it is one of those things that is patient to patient, and sometimes with mature patients that can be a day-to-day thing.